people are aware that you don't have to have a history to still have breast cancer. And of course, there's all the symptomatic things like changes in your breast. We always tell women the best screening tool you've got is your 5 fingers in your hand. Go and do your self exam because when you know your body, you're going to know when it changes, something changes.
Thank you for joining us for another episode of Spotlight Houston, where we bring you the best of the people, places, and events in Houston. This week, we sit down with Dorothy Gibbons, CEO and co-founder of the Rose Center for Breast Health Excellence. And now your host, Blanca Quezada.
Hi. October is a very important month for me because it's Breast Cancer Awareness Month. And it's the time of the year when many of us become aware that breast cancer has affected an innumerable number of women around the world, not just here in the States, but around the world. And that there's always that possibility that it can affect more women because they aren't proactive to go out and get checked. And the other thing, too, is we usually focus on women, but it can also be a health problem for men as well.
Mm-hmm.
I unfortunately lost a friend recently to it. And personally, I have also great experience with breast cancer. I found out about 20 years ago that I had breast cancer. And I just went in for my regular annual mammogram. And I was told that I had something there and it got caught early. So I was able to get some treatment and I've been fine ever since then. Thank goodness. I've been blessed.
Yes.
But even though it was a very aggressive type, it got taken care of. So I've been very fortunate. So whenever I can, I like to take the opportunity to inform and encourage women on how important it is to get an annual mammogram. And so with me today, I've invited Dorothy Gibbons. She is the CEO and co-founder of the Rose Center for Breast Health Excellence to help me get the message about how important it is that we take care of our health so that we can take care of our families and our friends. Dorothy, thank you so much for being here.
Absolutely. It's a joy to be able to talk to you.
Well, I've known you for a long time, so it's
Mhm.
definitely fun for me to have you here. So first of all, please talk to us about the history of the Rose because it's been around for a lot of years. And what was the inspiration for creating this nonprofit?
We're going into our 37th year. And back in the 80s, when we started this, was the oil bust. And so many people did not have insurance. So many people had lost jobs. It was the number one time of foreclosures in the history of Texas. So, I mean, it was pretty tough times. And Dr. Melillo she started at the hospital I worked at. And she was, of course, charming and wonderful. And one of those, she was like the second doctor to ever graduate as a surgeon. Now, in hospitals, surgeons carry a lot of weight.
Yeah, and
So,
she's great. She's great.
yeah, she is. And she continues that passion today. But we were seeing so many late stage breast cancers in women who the story was all the same. They didn't have money, didn't have insurance, didn't know that they needed a mammogram. That was before mammograms even became the screening standard, the gold standard in finding cancer. So we'd met a woman, her name's Rose Kushner. She encouraged us to move on. And I mean, Blanca, that's a whole nother story, how she hammered at me until we got the place started. But I just could not stand the idea that some of us could have coverage or some of us can have services and some of us can't. We've all been in tough spots before. I don't know anyone I've ever talked to that hasn't had some short time or long time in their life when they didn't have insurance. And what we've learned is invariably that'll be the time when they'll find something. So yeah, that's our mission hasn't changed. It's access to care, and we take care of a woman regardless of her ability to pay.
Yeah, I'm sure it's very scary for women in that situation because and frustrating because there's nothing they feel that they can do or they don't feel like they can go anywhere to get any
Right.
assistance at all.
And we've had many women come to us finally because someone told them about us, but who have exhausted their credit cards, gone to other places to get the mammogram, they need a diagnosis, but they sure can't afford a biopsy. So that's when we see them.
Yeah, and biopsies are really important too.
Oh, yeah.
So I know that the Rose is also recognized as one of the top specialty care facilities in Houston,
Mhm.
alongside the MD Anderson
Mhm.
facility, as well as many other facilities
Yes,
in
and this is
um,
about being a facility that is part of the safety net of Harris County, which is simply there's a place for an uninsured woman to go. Now,
mhm.
Blanca, we take care of insured women too. I mean, that's what keeps us going. And
Yeah, I
that,
was about to
yeah,
ask you about that.
yeah, that and our fundraisers. But we are the specialty care for breast that has become the safety net for so many women that just don't have insurance.
Mhm. What are some of the risks for women that causes breast cancer?
Well, first of all, I wanna tell you congratulations on being a 20-year plus survivor. That's an
Thank you so much.
inspiration, yeah, to
Thank you,
so
thank
many
you.
women. Your number one risk is being a woman, period. It's just the way it is. We've had women who were in the best of health, who have had many children, who think they don't have any history in their family. And that's something that's becoming more and more people are aware that you don't have to have a history to still have breast cancer. And of course, there's all the symptomatic things like changes in your breast. We always tell women the best screening tool you've got is your five fingers in your hand. Go and do your self exam because when you know your body, you're going to know when it changes, something changes. And that,
Yeah,
of course, is when you need to go and do it. But like you, if we find it on a mammogram, we've got a better option. We've got better prognosis,
and
just so many
treatments.
things. Yeah, and treatments. And of
Yeah,
course, over these 37 years, so much of that has changed. But the continuing problem in my world is that women just wait too late. And every single one of our stage 4 cancers, which this is part of that staging, that's the worst stage you could have. And I don't mean to say worse because you've got listeners out there that will go, oh my gosh, because I have lots of patients that have beat it. But every single one in the last 7, 8 years have been uninsured women. Now, if
mhm,
that doesn't speak to something, I don't know what does. It just got away from them and they didn't know where to go. And so
yeah.
that cancer kept growing.
Well, for me, as you mentioned earlier, I was healthy. I didn't think there would be anything wrong with me. I just
Mhm.
went in as a precaution, the thing to do annually, go get that mammogram. Also, there was no history of breast cancer in my family.
Mhm.
So I was pretty surprised when I got the notice. And
Right.
it's like, wait a minute here, something's wrong. But I think that maybe also hormone changes in a woman's body might be a
Yes,
possibility, a risk, a
There
caution.
was there was a lot of research done on did hormone replacement cause this, and it certainly feeds it, it doesn't cause it. I'm telling you, Blanca, we don't know why it happens. We don't really have a
Yeah,
cause for it. There's a saying in the cancer world that if we ever figured out what started breast cancer, we'd figure out what started most cancers. Because the breast can have 17 different types of cancer. And that's I really want to caution people when you hear someone else talking about their treatment or what if they're a breast cancer survivor and you are. Every cancer experience is different. Every tumor is different. You may have more aggressive or less aggressive. It just depends on so many different factors of that tumor. But I want to tell you something else. When those hormones are the most important is when a woman is pregnant. 25% of all the women who are diagnosed under 40 was within the first 2 years of a pregnancy. And here's why. I mean, there's lots of reasons, but your breast undergoes so many changes during that time. Getting ready to nurse, and invariably, if a woman finds something that she's a little worried about, well, it's kind of put to the side because there's so many changes in the breast. It has to do with your nursing. It has to do with
right.
what's going on in the breast. But this has become a real concern. And when I have young women who are pregnant and find something, I keep saying, go and get it checked. I mean, there's all kind of ways to check for it.
Yeah. And you're right. I found out very quickly that every woman is an individual and that every woman has a different type of breast cancer most of the
Mhm,
time.
mhm,
And even though mine was caught very early, they told me that if I had waited another year, I probably wouldn't be here because it was growing quickly and it was very aggressive. So I had I guess, a special type of cancer.
mhm.
And so that's another message that I think that's very important that women know that we're all our own little world and the cancers aren't all the same.
But Right, and the other thing is if you don't get the answer that feels good to you, and I'm serious, if something doesn't feel right, go get another opinion. You have
Mhm.
to be your best advocate.
Yes, definitely. And we always also hear about self exams, but sometimes we may think it's something and it's not, but we need
Yeah,
to go get it checked.
always. We had one patient that had always done her self-exam, always felt had lumpy, bumpy breast, and that's the fibrocystic that's going on, but it was like the 5th or 6th time when whatever she felt was cancer. So, we can't say just because you have that type of breast. Dense breast can be also a very concerning type of tissue, and many times we need to do an ultrasound with it.
Yeah. And that's another thing that it's not just a mammogram, that we can get ultrasounds as well.
Mhm, mhm, and
So,
MRIs are becoming very important to young women, and so we have the ability to send our uninsured so many different places if they need something outside of us, but we do offer the mammogram, the ultrasound, and the biopsies, physician consult, and if you're uninsured, we have a patient navigation program that's gonna help you get into treatment.
yeah, you have like a full range of breast cancer screening and diagnostic service
Mhm,
that you provide. And
mhm.
it's like the full gamut, right?
Right, and I think the other thing that distinguishes the Rose is we have now a fleet of mobile mammography coaches. We have 5, and they are traveling through 43 counties in Southeast Texas, and, Blanca, we there are so many reasons why women have difficulty accessing care, and what we've learned in the more rural areas is that if you want a mammogram, you gotta travel 45 minutes, an hour and a half, because it's not gonna be in your small community. So when we can take that to a community, it makes all the difference in the world.
Yeah, I'm sure that the Rose has helped save a lot of
Y
lives with your
Yes.
services. With
Yes.
your services. So why are so many women afraid of getting checked? I'm sure you've heard of many reasons aside from having insurance or not having the possibility of getting to a clinic or somewhere to get checked.
In some populations, it's just not knowing. It doesn't come up in everyday conversation. They're not in the healthcare field or they haven't had the opportunity to really know healthcare and what's good for you and all those kind of things. A lot of women will tell me they were afraid they were going to find something. And that's for years and years we've talked about find it early. Well, nobody wants to find it. But the whole message is don't be afraid of finding it, just be afraid of finding it late.
Yeah, it makes a huge difference, and I'm an example of that.
Mhm.
So that's why I wanted also to give out the my personal experience with it.
Right.
You
And I'm just curious, Blanca, when you had yours, was it easy to talk to people about it?
Yes.
See,
Yes.
you understand that importance of communicating.
Yeah.
And there were
Plus
years when
I
women yeah, excuse me.
yeah, sorry. Plus I was very positive about it because I knew that even though they gave me all this terrible information, that I was going to be okay because it got caught early and there was treatment and of course faith always helps.
I
Faith and hope.
I believe that, and we
So,
don't believe any woman is a statistic. I mean,
yeah.
we've seen miracle after miracle, so good for
Yeah.
you that you held on to that positive attitude.
Yeah. And also, I wanted to make sure that the friends and family members that I talked to wouldn't be afraid,
Mhm.
that there was nothing to be afraid of. And like you said, be afraid when you're late. And yeah, and there's a little bit of pain sometimes when you go in and get a mammogram, but that's okay.
Well,
It's not that bad.
we've come up with technology has come up with something called a soft curve, and it truly is a more comfortable mammogram, but it's always awkward. There's
Yeah.
it's kind to
Yeah.
me, it's as awkward or not as awkward as having a pap smear. Come on. Talk
Uh-huh.
about awkward.
Right. And the city here is so culturally diverse, and people have their customs and traditions. And I don't know if this is something that is difficult to talk about within their families.
Oh, absolutely. I mean, when we started this, it was very difficult even for educated women who were in the business world that had that exposure. That it's just every culture has a different attitude to different things. And you can't At the end of the day, if you don't realize how important it is for you to take care of yourself, we say self-care is not selfish, it's essential. Because, like you said at the beginning, you don't take care of yourself, then nobody else is going to get taken care of.
Right, right. Also, you mentioned a little bit ago about your mobile mammography program.
Mhm.
Do you have all the equipment that you
It's a
carry in that mobile
it's the
to do all the?
same. Yes, right now we're doing mammograms, screening mammograms. We are moving into doing some diagnostic on the mobiles. Now, we're not there yet. I don't wanna mislead anyone, but it has the 3D technology, so it's the best we could offer women. And again, it is making it accessible. So many times when we take the mobile out, we're in partnership with the local health clinic or a physician's office or a church or a school. Schools are huge. Teachers don't take time off. So when we
Mhm,
come in, they can take that 20 minutes and that's as much time as you need to be out of your office. And
mhm.
so it just makes a big difference. 75% of all the women we screened on the mobile last year said they would not have had their annual mammogram had we not come to their place of work or wherever.
Oh,
Yeah.
wow, that's a large number of women.
Mm.
So who gives the women the diagnosis?
When we have an uninsured woman,
Yes.
well, the doctors that we have, Dr. Malillo, Dr. Raz, Doctor, they are the ones that deliver the news to the woman because so many of our uninsured women really don't have the family doctor or the a
Their
real
primary care
history.
doctor,
Yeah,
they don't
right. They
have
don't
one.
have that. But the difference is our navigators are in the room with them. So from the get-go, they have someone there, and unfortunately, 70% of all those that we diagnose, English is not their first language. So they have someone who speaks their language, someone who is going to explain to them what the doctor just said. You've been there. When the doctor
Yes.
says you have cancer, your mind goes away. You
Yeah.
don't hear anything past that. So, we always encourage them to have someone with them, but our navigators are their friend throughout
Yeah.
this process.
Yeah.
And
I
they
guess
tell
I
them,
guess I was the exception because when I got the news, I said, "Okay, what are we gonna do about it? Who do I go see next?"
and I've heard that too, but more often than not, I've heard, I don't even know what they said next because so many women are thinking, or uninsured women are thinking, how am I gonna pay for this?
Exactly.
And all women think, well, what's going to happen to my kids or my loved ones? So that navigator is there. I mean, I truly believe everyone with any kind of illness needs a navigator, someone
Yes,
that already
definitely.
knows what you're up against.
Yeah, definitely an advocate. So once they're given the diagnosis, do you provide resources for these women?
Here's what happens. We have a program through the state that most 95% of our women can access. So that means that they have a Medicaid coverage, just like anybody. And they can go to wherever takes that coverage. Now, that's a little bit of the challenge because not all hospitals take it. But our navigators know which ones do, which doctors do. And so the patient doesn't even have to know. We just send them to where they need to go. The other thing is our navigators continue follow-up through their treatment. Now, it used to be that was 5 years that we would continue to follow them. Now, with so many different treatment plans and more stronger options for women, that could be 2 years. But
Yeah.
what our navigators are calling them about is, "What else do you need? What's going on? Do you have food in the house?" I mean, come on.
Yeah.
Cancer's expensive, even if you've got any kind of coverage. And we can help them find meds that they need. We can help them. There are many different organizations that offer help with rent. We don't, but we could connect them. And so I think that's the type of service we follow with them. And of course, we're in contact with whatever hospital they're having their treatment, so we know. And sometimes, Blanca, they don't make an appointment with the oncologist or for their radiation. And that's when our navigators, they alert us and our navigators will call. Sometimes it's as sadly as difficult for them to get to their treatment because they don't have a gas money. So we have gas cards or they don't have anyone to take them. And so we
Mhm.
put that into effect. When you don't have insurance and you're low income, there's so many things that you don't know about, and so
Yes.
many challenges that most of the world doesn't realize is going on.
That's why I love the rose because you get to hold that person's hand and make sure that, if it takes a couple of years, you make sure that they're going to be okay.
Right.
Yeah.
And we talk
And
to the children, we talk to the spouse, and let me tell you, every man wants to fix it.
yes, they do.
Mhm.
and well, they can't fix it physically, but emotionally they can
Oh, they can be
somehow.
such support. And I'm just gonna do a shout out. We're doing a podcast also. It's called Let's Talk About Your Breast, and we've had some men on there, men who have had breast cancer, talking about what happened with them and how their wife took it. But also, we've had lots of men who have had their wives go through it and have told us what they learned and how to support her. And it's as hard on them, it's as hard on the family. I mean, they're not experiencing it, but when you don't know how to help, you're just so helpless.
Yeah, and they try not to show that they're scared,
Mhm.
that they're afraid of what might happen.
Right.
They just kind of shut down sometimes.
Mhm.
So, yeah, they need help too to
Right.
deal with what's happening. And of course, the children, because the children sometimes don't say anything, but they sense it,
Oh,
you
absolutely.
know.
And they're seeing it. Mother may
Yeah,
lose her hair, mother's sick, mother doesn't feel
yeah,
like getting up. So,
yeah,
of course, that's incredibly scary for a child.
yeah. So I'm great you're there to help the not just the person, but the entire family as well.
Mm.
You have another program called Medical Home Program.
Oh,
What is
yes.
that all about?
So many of our women, as we said before, do not have a primary care doctor, a provider. Maybe the last time they saw a doctor was when they had their child 10 years ago, or last time they even had any access to any kind of health care. So, one of the things that is a regulation in the world of mammography is that you have to have a referring doctor to send the results to. So, if our ladies don't have a referring doctor, there's no one to send those results and help us get them back in. I mean, it's there for a reason. Our mammogram to medical home is that fills that gap, solves another barrier. We have a nurse practitioner. She works for under the supervision of an outside doctor, and she takes these women and does a high level breast health exam, just finding out what meds they're on, what have they not had checked in a long time, those kind of things. And then she does a breast exam. And then if she doesn't have any reason to think that woman's diagnostic that needs more care, or even if she does, she's gonna write the order and get her in. So if the woman's normal, everything's good to go, then our team in the Mammogram to Medical Home program goes in action and finds them a medical home. This is not the program that a woman can come to forever. It is the whole purpose of it is to get her somehow in that healthcare system with access to it. Many don't even know there's programs out there. They don't know about the health
Right.
clinics or the FQHCs, the federally qualified health clinics. It's just it's that extra. Now, if she has a problem, of course she's going to go through our system and into patient navigation.
Mhm. Well, I guess a lot of times women don't know about all these programs or all this help that's available
Mhm.
because they've never been in that situation before and they don't know who to turn to
Right.
and they don't
And
know that assistance is available.
and Blanca, it's tough to ask for help. It's really tough.
Yeah, it really is. It really is for many different reasons.
Yes.
Many different reasons. So, as a community, what can we do to help the Rose?
There are so many ways. You can always come to us and bring your insurance and have your mammogram. That we always have to remind people of that helps us. But during the month of October, that is our largest fundraising time. And it's all about third party fundraisers. And that means that someone else is doing the fundraiser and they are raising money for us and we don't have to do it. They raise it. We go and speak at the event if we need to. They bring us a check. I mean, let me tell you that you cannot imagine how much that means to us. And in years past, it has totaled up to $700,000. Believe me, we don't have many grants that are even anywhere near that. So different ideas are we've had women do bake sales, we have businesses sell T-shirts, give us the proceeds. We have Jump for the Rose, which is the 22nd, 23rd of October. Now, this is where you can jump out of a perfectly good airplane and
Oh,
raise
wow.
money for the rose. I've done it. It's great. It is the experience of a lifetime. We have Serve Up a Care as a group that they have a tennis tournament for us. We have people that barbecue and sell plates and make money for us. And we have a really special one it's called Booze and Boobs. Now, that's not something I would normally even say, but it's a top fundraiser we've got when it comes to third party. The other thing now, so there's all kind of ideas. We have a brand new third party event form and suggestions online. It's so easy to do. And so if you have an idea, I mean, my gosh, these are incredible ways to help. It's everything from the restaurants to the individual people to just so many different ways. I'm always amazed at the ingenuity of people who have a
Yeah.
reason to have an event. And this is something they do. It is a
Yeah.
great way to feel like you're really helping people in the community because you come to the Rose, you can see those women in our reception areas.
Yeah.
There's no doubt.
A lot of local shops will also sell either socks with the little pink ribbons or jewelry with the little pink ribbons.
Mhm. Now,
Um,
if it's not coming to the Rose, don't buy it.
okay. All right. Good message there. Good message. So, in order to get more information about everything that you provide, where can we get that?
Just go to our website. It's very easy to navigate, therose.org, O-R-G. And Blanca, you're another way that we share our events and our services. Anyone who could be an advocate for us in any way, tell the neighbor, share that. The Rose has been built on word of mouth. It's been built on the trust of women coming to us. And so we
Besides
always
besides
appreciate
the
that.
besides the website, do you have a phone number?
Yes, it's 281-484-4708. I'm gonna tell you
Perfect.
though, go to the website if you can. It's phone
Yeah.
easy. It's just so much. You
Yeah,
can
it's just
make an
that
appointment there. Yeah.
it's just that I'm thinking there might be a lot of people that might not have a computer available
Oh, true,
or a way
true.
to
Yeah,
connect to the
for
website.
sure.
Yeah. So, Dorothy, personally, what's the most important message you want to give our listeners?
Oh. I think the most important message is that every woman's worth it. You're an individual. There's no one like you ever. Will be no one like you ever again. And I want you to take care of yourself.
Great message. Thank you so much. Thank you for being here, for being on the show, for sharing so much information. And personally, I think there's no reason or excuse not to get a mammogram, especially if you call the Rose and if you need help, they can help you. And of course, thank you all as well for being with me thank you all for being with me on Spotlight Houston. Remember, if you have any comments, please get in touch. And if you have any story ideas, please let me know.
Thank you for joining us for this episode of Spotlight Houston, a production of Story Zone Media.